Yes, I spoke this morning about the need for us to consider that we are in a very important transition in the technologies for healthcare. And my messages were very simple. I think the complexity of biological systems, both in health and disease, is such that we need to use new methods. And these new methods involve more than just doctors or biologists. They involve physicists, they involve engineers, they involve also data scientists, people who understand the amount of data that we're generating. And that is necessary if we're going to apply what we learn from these complex systems into treatments for patients. And I was also mentioning that in technologies for the life sciences, we're going to have a major need for improvements in the production of medication, biological agents, to reduce the cost. It's too costly right now, takes too long, and it's really imposing a real burden, while at the same time there are new technologies that could be applied. So it's a message of hope, but also a message about the grand challenges, complexity, and the precision that we need for each patient, and the fact that people have to work in teams based on understanding the systems, not just each molecule. Well, there are many opportunities. I mean, first, let's just talk about taking care of patients, right? 80% of the cost of healthcare today is related to patients who suffer from chronic diseases, like diabetes or heart disease or long-term diseases or diseases of aging. Today, the system takes care of them within hospitals or emergency room. It's very expensive. And then on top of it, it's sporadic. So you see the patient every 3 months or every 6 months, but what happens in between? Now we have the technologies to change that. We actually can sense the pulse, we can measure the blood pressure, we can follow the patient at home. Just with a smartphone, we can actually tell how healthy the patient is, especially when it comes to mental health or dementia or physical ailments. We can measure actually the motion of a patient. We can measure how fast they type, how their voice is changing. All of those revolutions of what we call digital biomarkers is going to change the practice of medicine, in my view, where we will follow the patient continuously. But on top of that, we'll have what we call artificial intelligence, because there won't be enough doctors to take care of these populations of patients. And so that, I think, is one opportunity. The second is in biology itself, not just for medical use, but for agriculture, for environmental issues. We have the means today, the tools, to start understanding, but also modifying the biology. So today we can change genes and we can really correct genes. It's called gene therapy, cell therapy. Those things are growing and are going to really change the ability for us to cure diseases, in the sense, correcting for them in the first step, but understanding them to the point where we could actually come up with cures. And hopefully the third opportunity is to be able to do it with multidisciplinary teams that work together to accelerate the process. And I think we can do that. It's already done, for example, for the vaccines. Look, it took us 10 months to develop the COVID-19 vaccines, 10 months. Every expert said, it will take 3 to 5 years minimum. But with the mRNA technology, which has just come out 10 years ago, we were able to change the world and make a vaccine basically in 45 days and test it over 8-9 months to make sure it was safe. So those are the three opportunities. I think ethics is going to be intrinsic to every change we make. Any change really requires an ethical view. But it's more just than an ethical view, it's a social science view. So I think it's more than ethics, it's what happens when you change the paradigm of treating patients at home. What happens to their family? How are they giving care? How come we see this as a technology issue? It's not. It's a quality of life issue. It's a lifestyle issue. All those things need to be integrated. So ethics are core, to what we do.